I'll be presenting on the paper that we're working on right now. I thank my co-authors, Dr. Funahashi and Dr. Miletus, for the help they've given me. The study is entitled Baseline Activity Levels Patterns Follow ACL Injury Patterns. No disclosures to say. So first about the background. So the amount of physical activity that a person of any we encounter in our clinics can vary throughout their life. There's many different things that can influence this, including their age, their sex, their race, and their changes in their life. So not all of us can be the 80-year-old female that's powerlifting 300 pounds every day. I don't anticipate I'll be able to do that. We also know through many other studies and registry work that rates of ACL injury and surgery also differ among these different demographic groups. Through the studies that we've had through the KP ACL registry, we've seen that they're more prevalent in the young population, but there hasn't been any studies that we know of that specifically look at all comers with the physical activity rates and their ACL injuries, if these have any corresponding trends. So we decided to design a study with the specific aims of investigating if the demographic rates of physical activity follow the same rates of ACL surgery among a captured cohort of patients. We hypothesized that women would be less active than men, older patients would be less active than younger patients, and ethnic minority patients would be less active than white patients. Then looking at the ACL and how this might have the same kind of trends as activity, we also hypothesized that rate of physical activity would follow the same demographic trends as those in patients receiving ACL surgery. This is just kind of intuitive to think that the more active groups would also have more ACL surgeries. So the methods that we employed: first, in 2009, KP Southern California started collecting an exercise vital sign. The patients, when they arrived in the clinic, were asked 2 questions with every visit. 1, on average, how many days per week do you engage in moderate strenuous exercise like a brisk walk? And 2, on average, how many minutes do you engage in this exercise at this level? This information was then collected as part of their electronic medical record, and this exercise vital sign was formally validated by other papers that were published in the literature earlier and showed this was a valid outcome measure to make sure that patients are actually reporting correctly and was a good vital sign to use. The data collection that we had, first we had the median total number, or the median minutes of exercise per week, and also the total minutes per week of exercise used all the way from 2009 to 2016. We used the median minutes per minute week exercise for analysis to control for extreme differences in self-reporting. We then also took the demographic information for all these patient visits for age, race, and sex from the electronic medical record. We compiled over 17 million visits for the patients in the Kaiser Permanente system that had the exercise vital sign. The demographic information for ACLs then were taken from the KP ACL registry for age, race, and sex. And the important thing to note is that all the KP patients are obviously a captured population. So the exercise vital sign data and the KP ACL registry data came from the same cohort of patients. For analysis, we used descriptive frequencies for physical activity. The median number of minutes exercised per individual for each individual demographic was analyzed by race, age, and sex. And then we combined these to further analyze the data for age and race, sex and age, and sex and race. And then we divided the age increments into 3-year increments for data analysis. For analysis further, to see if any one group was more or less inactive than the other, we divided each patient group, we divided our data into 3 different groups based on the Nutrition, Health, and Examination Survey for the United States. The 3 groups were inactive, insufficiently active, and sufficiently active. Inactive patients had no exercise. Insufficiently active had a median of 90 to 149 minutes per week, and sufficiently active had a median of 149 minutes per week. Poisson regression model and robust variance estimation for prevalence ratios and confidence intervals were done to determine if levels of inactivity and insufficient activity were associated with any certain demographic, whether it be age, sex, or race. Finally, we used descriptive analysis to compare the physical activity trends and ACL surgery trends in each demographic group that we had. The results that we found: first, exercise median based on gender. We found that females were less active than males in general at all comers, males being almost doubly as active as females per week. Next, we based it on exercise median on race. Whites were active and blacks were the least active, with whites being 100 minutes per week and blacks being 60 per week. Exercise median based on age. Younger patients were more active than older patients. This is kind of intuitive. When we're young, 14 to 17, we're exercising 300 minutes a week. And as we get older and we start to get families and get 4 kids where pulling your hair out happens all the time, then you start to get less and less exercise. Exercise now combined with race and gender. And this is in contrast to solely just race analysis. Black males actually were the most active out of any group, while Black, Hispanic, and Asian females tended to be the least active. Age and gender. The young males and females all had higher median number of minutes exercise per week. And again, as they got older, these both downtrended. With exercise based on age and race, all the races showed high levels of activity, again, when we're young, 14 to 17 years of age, and they slowly decline over time. The one ethnic group that did maintain the highest were the white ethnic group. They had the highest number of minutes when they were at the oldest age group of 36 to 40. They still had 90 minutes per week. Then we wanted to make sure that, we wanted to see if any one of these 3 categories, gender, race, or age, corresponded to being inactive or insufficiently active. So we used our 14-year-olds, our males, and our whites as baselines. As seen here, they're all of 1. We found that the 36 to 40-year-old range group were 2.1 times more likely to be inactive compared to the control. Women were 1.16 times more likely to be inactive than our control, and that blacks were 1.22 times more likely to be inactive compared to whites. So, and then on the far right, we see this is our insufficiently active. The trends followed the same, although they weren't as strong. Now to get to where the physical activity joins with ACL registry, Dr. Miletus formerly published on demographic rates in the KP ACL registry and looked at the different demographic trends for patients who injured their ACL. So we wanted to tie the two together. So what we found is in our study that males tend to be more physically active than females, and also they had a higher rate of ACL surgery than females. We also found that young patients, of course, in our study were much more active, and they also tend to have a higher rate based on Dr. Miletus's work of ACL surgery. Now, the interesting thing is we found that young males were more active than young females. However, their ACL surgery rates, especially in the very young females, was actually just a slight bit higher. So this kind of went against our physical activity data. But then finally, whites tended to have higher rates of physical activity, ACL surgery, and even another paper published by Dr. Miletus showed that they even have a higher rate of ACL revision surgery. So in summary, the rates of physical activity vary among different demographic groups, and the relationship between physical activity and ACL surgery has not been clearly established. However, using some of this exercise vital sign data in a captured population, there does appear to be some demographic trends between ACL injury surgery and the rates of physical activity. So the literature that we have on physical activity, and especially this exercise vital sign, has shown some of the same trends that we have. Coleman initially showed, and his group initially showed a lot of the same trends that we had. Females, older patients, and racial minority patients all tend to be less active, a lot of the same trends. The Moon group and their ACL registry also found that younger patients who had ACL surgery tended to be very active at baseline. Maybe some of the same things that we found. However, our study does capture more patients than other previous studies. We have over 17 million data points, and this may validate our demographic trends that we found for physical activity. Also, our study captures all the comers of a general population. The KP registry of this exercise vital sign is not just people that are looking for specific surgeons to do a high-level surgery for their high-level athlete. So this might represent more of like the population that we might see in our practices. If we're not at some high university or if we're not in this high study group, this is what we can maybe generalize to our population. The Moon group does a wonderful job at what they do, but this may just be certain very active athletes and people that are looking for these high-level surgeons. So causation cannot be determined as to why younger white and or male patients are injuring their ACL. This might be due to we're missing reporting these, we're not capturing these patients. It might be to social economic statuses, anatomy, physiology, all these things are in the ACL literature as far as why people are having their ACL injured. But from our study, we may be able to infer that these patients these patients that injured in their ACL are more active and therefore more likely to injure their ACL. We do provide objective data that young male and or white population is indeed more active, and it's not the sole contributor, but it may be contributing to a factor as to why young, white, or male patients are experiencing an ACL injury. Thank you for your time.